Nearly one-third of U.S. states are rolling back mask mandates after the CDC updated its guidance last week. The agency said Thursday fully vaccinated people don't need to wear masks or social distance indoors or outdoors, although with some exceptions. But some experts say it is all too much too soon. Dr. Ron Elfenbein joins us now to help us sort through sort of the mask confusion. Thanks for joining us, Doctor. The CDC says that the new mask guidelines were partly based off of new data, but it sparked a lot of confusion. I know when I was out and about this weekend and I was in sort of two different states, I think maybe like 70% of the people still had their masks on outside, and certainly in some of the businesses, masks were still required, and in some cases they were still checking your temperature. And I think that a lot of people just thought, I don't know what's the right thing to do right now. Let's just err on the side of caution. And also there's this whole thing that it's kind of depending on the honor system as to whether or not you are actually fully vaccinated. So I just want to get your take on the decision from the CDC.
Yeah, so I actually applaud the CDC because this is kind of really, truly following the science as they suggested. It is weird, and the whole thing is very confusing because on one hand, the CDC director, last week said that we're going to still be wearing masks and the masks are so important, and then literally like a few days later came back and said, well, now we think once you've been vaccinated, you can stop wearing masks. I actually went to Sam's Club a couple days ago, and I didn't wear my mask, and it was the weirdest thing. My 13-year-old son actually said to me, he goes, "Daddy, this is going to feel really weird not having to wear a mask after we've been in masks for over a year." And I said, yes, it takes a little getting used to. I kind of felt like I was naked walking around the store with no mask on. But right. This is what the science suggests, is that once you've been vaccinated, what's the point of vaccination, right? It's to keep you from getting sick. And if I'm vaccinated, why do I really need to wear the mask anymore? And, the CDC is finally really acknowledging that the data is out there, and that's kind of what it shows. But it is confusing for people. And of course, if individual businesses still want people to wear their masks, that's their right, and they can demand that you wear a mask if you walk into their store.
It's tough, right, Dr. Elfenbein, because, I'm fully vaccinated, my wife is fully vaccinated, and so even if somebody isn't vaccinated, we're not super worried. Just maybe a little bit worried because it's 95% effective against the coronavirus, not 5%. But, I just wonder how often we're going to come into contact with people who are not vaccinated. I already had two instances last week on Friday when I was just chatting with somebody randomly, and they just mentioned that they haven't been vaccinated. And it was interesting. They said to me, well, I'm still waiting to see what the science says on it. And I suspect, and that's in New York City, where, the information, just because we got hit so hard early on in the pandemic, has been out there for quite some time. I wonder if you're in a part of the country where you don't have access to information, or you don't have the capability of getting to a vaccination site for whatever reason, that, more often than not, I think there's a notion that because we see images, and even in the media, we're showing people starting to live their lives again, but then there's notion that we're all vaccinated and so we can get back to normal, when the numbers actually prove otherwise.
Correct. That is a good point, and that's very true. I would just say that, you can only control what you're doing, and you can only worry about yourself. If people choose not to get vaccinated and to go out without masks, that's on them. That's not on you. You do what you think is right, and other people will do what they think is right. And, obviously we want everybody to be vaccinated. We want to be 100%, to reach that 100% threshold. I don't think that's going to happen. And yes, it is the honor system. But again, if people want to do stupid things and not wear masks and expose themselves, unfortunately, there's not much we can do about that. But this would hopefully be a kick in the pants to those people to say, hey, yes, you should go out and get vaccinated because you can go back to your normal life again. This is the first step, really, to going back to that life. And I think that's again, I applaud the CDC for kind of following the science here.
And I should point out that you're talking about adults, but, most children in this country are not vaccinated. I know that there's been emergency approval for one vaccine, but, still most kids, if you're worried about how many people you're going to be talking to, if you're talking to children, chances are they're not vaccinated. But I think that this is the sort of thing that this following question that I have for you is the sort of thing that adds to people's confusion and concern. Over the weekend, the nation's largest union of registered nurses called on the CDC to revise its new mask guidance, saying that the changes are not based on science. Can you explain what they mean and why they are concerned?
Yes, I think part of this is political, and that is that, I'm an emergency room doctor, so I'm in the emergency room. Obviously, I'm face to face with people with COVID all the time, as are a lot of the nurses that the nurses union represents. So I think that part of it is that they don't want their members to be at what they perceive as at a higher risk. The other thing is that they came out and said that the CDC, they believe that the CDC now won't be tracking people who are fully vaccinated but then get COVID as follow-up, so the so-called breakthrough cases, that the CDC announced that they're going to be moving their resources to other things, and that is something that the nurses union disagreed with. And I would agree with the nurses union on that. I think that the CDC should be looking at that for longitudinal and long-term studies to see really how efficacious these vaccines are over the long term, because we don't really know that. And of course, the FDA is looking at that, and other organizations are looking at that, but the CDC has said they're going to kind of move away from it. So I think part of that is what the nurses union was talking about.
Right now, so this is what we've been talking about, Dr. Elfenbein. Less than 40% of the United States population is fully vaccinated. It doesn't appear at this point. I know that there are efforts in place by the administration to convince people to receive the vaccine. Just looking at the data, it doesn't appear, at least not by July 4th, that we're going to get to herd immunity. And this is a question that I have. We've reported that 9 New York Yankees, members of the New York Yankees baseball team, have become infected with coronavirus, even though they are all fully vaccinated. You mentioned just, living your life, you're not in control of what happens to others. But with regards to the mask mandate, I think sometimes, this is perhaps a reason why, even if you are fully vaccinated, if you happen to be in an area that is, in close proximity with a lot of other people, maybe you should consider wearing a mask. Because on one hand, the science says that if you are fully vaccinated, the risk of transferring coronavirus to somebody else is low in the case of these Yankees who are infected. But you could still do it, right? And if you do infect somebody who is unvaccinated, even if you are vaccinated, what are the risks for them? Is it as bad as it would have been if 2 fully unvaccinated people had infected one another?
So great question. We to answer that directly, we don't really know. We believe that if you're vaccinated, that you are infected and you are passing it on to other people, it would be less of a viral load than if I was unvaccinated, for example. So the thought process there is that your risk of transmission and the risk to the other person is much lower if the person has been vaccinated. To speak to the Yankees, so there's a few things that took place here. So you have nine Yankees that tested positive, 8 of whom are asymptomatic, which shows you that the vaccine works, number one. Number two, remember, the vaccine was not designed to keep people from getting COVID. All the vaccines were designed to keep people from dying or being hospitalized from COVID. So a couple of things could have happened here. They could all be false positives, which is certainly possible. Remember, these people are being tested twice a week, which is not normal. Most people in the world are not being tested twice a week. So these people are, which raises the chances of there being false positives. They could have had COVID and they're still testing positive because they still have the viral particles in their nostrils, which can linger for months. They could be really infected, which is a possibility. Or it's possible that all these people got the Johnson & Johnson vaccine, and they all could have gotten a bad batch of vaccine. It could have been left out on the counter too long. Their bodies didn't respond properly to the vaccine. We just don't know. So they definitely need to investigate this more, because it's definitely a very interesting, breakthrough cases. The average incidence of breakthrough cases is about 1 in 13,000 of vaccinated people will test positive for COVID. So obviously, this is much higher incidence amongst, I don't know how many people are on the Yankees ball club, but whatever that number is, it's certainly not. This does not represent 1 in 13,000. So I think they need to investigate this a little bit more. But it definitely is a very interesting case.
All right, Dr. Ron Elfenbein, thank you. So later today, President Biden will deliver remarks on the country's pandemic response and vaccination efforts. You can stream that here on CBSN live at 1 p.m. Eastern.